Live from Nature's Fair Markets in Vernon, BC, naturesfair.tv presents Integrated Cancer Care with Lisa Kilgour and Dr. Joe Schnurr. Now here's your host for the evening, Karen Marquardt.
So once again, good evening, everyone. Thank you for joining us this evening with the beautiful sunshine we've had tonight for our first day of spring. And what a way to kick it off with InspireHealth joining us here this evening at Nature's Fair Markets. So our very special guest has come from Saskatchewan because he chose to find that it was much nicer here in the Okanagan. So he set up his clinic here, and he is the lead physician of InspireHealth for the Southern Interior. And he uses an integrated approach to health, encompassing body, mind, and spirit for healing. He's got some great tips for you this evening about how you can improve your health and prevent disease. Joining him this evening is Lisa Kilgour, who, of course, is Nature's Fair Nutritionist. We're so thrilled to have her joining us, as well as she's partnered with InspireHealth. And she says that the experience there has been utterly amazing, in her own words. And, of course, Lisa has been voted BC's favorite nutritionist, so we're happy to have her connected with InspireHealth, as well as Nature's Fair Markets. Please help me welcome our two speakers tonight, Dr. Joseph Schmurr.
Good. I'd like to thank Nature's Fair for hosting this event and for all of you for coming out here tonight. My background is in family medicine. I spent 25 years practicing family medicine in Saskatoon, teaching in the College of Medicine over 10 years as well too. And one of my passions is integrative medicine and looking at underlying causes of chronic disease beyond looking at just simply symptoms. And in the course of this evening, what we'll sort of the things that we're going to explore is looking at underlying causes of chronic illness and particularly cancer as well too, and how we can address those underlying causes and try and get us back onto a healing track. So what I'm going to talk a little bit about, just a brief mention of InspireHealth. That's where I've been working for the past year. InspireHealth is a physician-led, evidence-based, patient-centered, not-for-profit organization that's been operational since 1997. Started in Vancouver. And in October 2011, opened its doors and expanded to Victoria. And in September 2012, in the Southern Interior Center opened in Kelowna. And we have an online center, rural and remote one, that has been operational since February 2012. And so what we do there is that we support people with cancer and their families to play a more active role in their own cancer care and healing, looking at addressing those broader aspects of health and healing that support the immune system and in conjunction with their standard cancer care. And we'll talk again in this evening what those broader concepts are. Physicians are either on salary or through contract with the Ministry of Health, and so our services are free. We have nutritionists, exercise therapists, and counselors so far at the Victoria and Vancouver Centre. We've served over 7,000 patients with cancer to date so far, and with a capacity of 900 per year and growing. We have programs, many different programs that are addressing and supporting the whole health and healing aspect as well too. And we have a research department that informs much of the work that we do as well too. So I'm just going to take a couple minutes just to talk about the state of our healthcare and where we are now, because we need to understand where we are to know where we need to go. We know that approximately 9 million Canadians have one or more chronic illnesses, and this number is likely to increase as the population ages and the number of risk factors increase as well too. We know that the economic burden is substantial as well too, in that people having more chronic illnesses are going to end up consuming more of the healthcare dollars as well too. And so, why are we seeing this kind of situation? That's what we're going to address. So at the heart of medicine lies the individual's patient's unique story. And that's always one of the things that probably initially gets doctors very interested in getting into the practice of medicine, is really taking that story, listening to that story. Now, sadly, we get into a very busy practice, and that story tends to fall by the wayside a little bit, and we start focusing more on symptoms. And in an acute care system, that's exactly what you want to do. So the patient's story tends to be squeezed down, and the diagnosis becomes more of central importance. And so in a situation where we have something like an acute health problem, say, for example, somebody's showing up with wheezing, we're going to do a history of presenting illness, find out that they've got shortness of breath, they've had a cough, they've had an asthma history. And so we quickly come to a diagnosis of acute asthma. And then with that, we know then, okay, we're going to start some treatments and give them various medications. This is not a situation where you want to sit and spend a long time, taking their social history, finding out, in terms of what their job is like, in terms of family history and that kind of stuff. You need to treat this and treat it quickly. And so when you have a very obvious, straightforward problem right in front of you, you deal with it. But the problem is sometimes those things aren't so obvious, and they present in many different ways. And the problem is when we're using an acute care model to treat chronic illnesses. So what happens in this model then is that the clinician is looking at directly proceeding to a diagnosis and naming the disease as quickly as possible, find a medication to treat it. And so what happens in this kind of situation then is the result is more on, focuses more on treating symptoms and less so on looking at the patient's unique story. And so we see things, and people may end up presenting with something like heartburn, and we'll say, okay, well, you've got reflux disease, and treat that with some H2 blockers, or high cholesterol, or depression, or high blood pressure, and we'll put them on medications for that. And so we can have a whole bunch of different types of symptoms, and we have a whole bunch of different kind of treatments for that. And in fact, then what happens is that each of these symptoms becomes a distinct entity unto itself, and the whole, the underlying pattern that might be contributing to these kind of things go unrecognized and untreated. And it's not uncommon that in my practice, and I was treating, especially dealing with a lot of chronic illness, I saw many patients who, in fact, would come in with all of these, a whole list of problems. And in fact, sometimes that's what may distinguish a holistic doctor from a regular doctor, is that holistic doctors see patients with a whole list of problems. Whereas we know that nowadays is you get one shot, one symptom is what you get to deal with. And again, that is a problem with the healthcare system in terms of not having the adequate manpower and the time to deal with things adequately. And what happens then is that when we're focusing on one symptom without maybe really understanding what's behind it all, we may end up fixing one problem and then creating another problem entirely. And so if we look at this in context of cancer, this is called the old tumor-based model, and sadly it's still the current tumor-based model as well too. But here we have the focus of the treatments is on the tumor. So the focus is really on the tumor. The individual themselves are kind of lost in all of this. And these treatments, the surgery, radiation, and chemotherapy, are very important and can be very important in terms of targeting the tumor. But in this, the whole person is lost, and what other things might be contributing to this, and what other things might be helpful. And we have it in this situation then where the physician, who has to be an expert in this knowledge of chemotherapy and drugs and things like that, is going to be directing the patient as to what to do. And so in this case, the patient has less of an input into their own disease process and in terms of their health and healing and recovery. So what we see in a situation then is that we're often treating downstream kind of problems without addressing the upstream kind of problems. And while it is important to address these downstream problems, and don't get me wrong, that's important to do that, we need to also look at, though, what else is maybe happening upstream, and what can we do to correct this. Now, we also look at this situation, and so here's two doctors mopping up the floor. What do you think is missing from this picture as well, too? The patient. Yes, exactly. Because you know, this, it's not just something that we as healthcare physicians need to look at in terms of trying to resolve this issue. Patients need to also take an active role and become engaged in their own self-care as well too. And that's what we're going to talk about: how you can become more engaged in your own care, and why that is important to do that, and why you're going to see some good results with that. We know that chronic disease is almost always preceded by a period of declining function in several mechanisms, one or more mechanisms in the body system. And returning a patient to health, or at least substantially improving their health, can mean reversing or substantially improving these dysfunctional mechanisms. And these dysfunctions are often the lifelong result of an interaction between a person's genetics, their lifestyle factors, and their environment. And these things, again, you have to take a history, you have to take a story, because this is what makes patients very unique, that even if they have something like migraine headache, it's going to be different in terms of their genes, it's going to be different in terms of their environment, their lifestyle factors are going to be different, and so you may end up having different treatments for migraine and have different outcomes as well too. So this cut off at the top here, it said the big 5 mechanisms contributing to dysfunction and illness. We look at probably these 5. I see at least one, if not all of these, in many patients with chronic illness. We look at oxidative stress. Oxidative stress meaning that the formation of more free radicals. Now, free radicals we make all the time. Just the act of being alive, we're constantly forming these free radicals. But if we make too many of them, more so than our body can bring into balance, then that's when we're creating this oxidative stress and damage to our health system. And so things like smoking, excessive alcohol intake, exposure to radiation, other toxins can cause this oxidative stress. So we have to be aware of those things. Inflammation, we can have, and not talking about the inflammation like when you have just like a red swollen joint. This is often inflammation that goes unnoticed, kind of at a blood vessel, a cellular level, and we're often unaware of it. And again, there are many factors that can contribute to inflammation, and ones that we need to start thinking about and be aware of and look at reversing. And we'll talk about that, and Lisa will talk a little bit more about that as well too. Elevated blood sugars, the stress hormones and chemicals, that whole psychosocial environment plays such a critical role, and we'll talk about that a little bit later this evening as well too, and why it's important to know what's happening in that psychosocial environment, because that plays a large role in terms of creating inflammation and elevated blood sugars and suppressing our immune systems. And so we want to make sure we look at that and address that. And then a growing problem is this use of toxins. In the last 50 years, we're getting so many more chemicals in our environment, and so we need to start being more conscious and more aware of what that means, and how we can look at correcting that. So we look at one condition that can in fact have many imbalances. So we look at obesity, and it may be not just one simple thing that's one dysfunction. It can be multiple. So there could be inflammation, it could be hormones, genetic factors, diet, exercise, mood disorders. There's now more evidence showing that people who aren't getting adequate sleep at nighttime are more likely to have obesity. There's very, very good solid evidence that shows if you have more organophosphides, the various kinds of pollutants and contaminants in your system, you're more likely to have obesity as well too. And we also have, even though we may have one imbalance, it may end up causing many conditions. And that's why we see that people who, say, have heart disease or who have cancer often are at risk of other multiple problems. And that's what we'll see. You know, people who have cancer, in fact, studies show, are at more risk of developing diabetes. They're at higher risk of having heart disease and depression. And so we want to not just tackle the one illness that we're seeing, but looking at underlying conditions and correcting that inflammation. And so when we see patients in our office, and this reads, "You're not ill yet, Mr. Blundell, but you've got potential." So oftentimes if we're looking on the surface, if we're taking a history and just doing an examination, we may not be, if we don't really dig down to find out are some of these underlying mechanisms dysfunctional, we may not, at least at this point, realize that this person may on the surface look healthy, but underlying it may in fact be on the way to developing one or more chronic illnesses. And when we start to look at these underlying mechanisms and expanding our toolkit, we start to now have a whole bunch of different resources to call upon. So we can still use the drugs and surgery and all the things we see in conventional medicine. We can also start looking at maybe the benefits of acupuncture, nutraceuticals, maybe counseling, and a whole bunch of other things, a personalized exercise program, and all these things that will contribute to health and well-being. But when I talk to some colleagues about integrative medicine and even some people in the public, they think that, well, if you're introducing integrative medicine into the current system, we might be looking at something like this, but that's not the case. We're looking at that whole approach to addressing these underlying dysfunctions. So in other words, what we're looking at is really looking at the whole person. So still targeting that tumor in that individual is important with these therapies. But equally important, if not more important, is looking at the whole of that self. Because we are, like I said, more than just our illness, more than just our tumor. So we want to look at what other kinds of things can contribute to this, to our well-being, and can in fact have some impact on that tumor as well too. And it used to be thought that in fact we didn't have much influence over our genes. The genes were the kind of, we were dealt with that, and that's the kind of cards we have to live with. But in fact, the last 2 decades, science of epigenetics is now showing us that we do have influence in terms of the activity of our genes. And in fact, further research is showing that actually what's more important in terms of the prognosis is the activity of the genes in the tumor microenvironment. So that environment of cells and tissues around the tumor, what those genetic activity is like. So are the gene activity promoting tumor growth, or are they restricting tumor growth? And of course, we want to do the things that can restrict that tumor growth. And there are things that we can do, and these are the things that can all be very beneficial. These are all what are called epigenetic modifiers. They modify that gene expression and gene activity, and can be either both beneficial or harmful. And so if we're looking at poor nutrition, it's going to send the wrong signals to our genes. If we're looking at good nutrition, it's going to change that genetic signaling. And again, Lisa will talk a bit about that. So we want to incorporate any and all of these types of ideas in looking at improving the health of ourself. So looking at nutrition, exercise, stress reduction, looking at emotional and spiritual support, reducing toxins. And then when we start to look at those things, these are things that we have some control over now. And so no longer are we passive recipients of the treatments we're receiving, but we can become actively engaged in our own self-care. And we can certainly then still get all the benefits of the support from our various healthcare providers. So I will turn this over now to Lisa.
Hello, everyone. Is my mic on? I have it turned on, I think. Hello. Just waiting for sound. Do I have sound yet? Let me make sure I'm turned on. Oh, there. I hear it. Do you need it closer? I like to be hands-free. I talk with my hands. So if we can get it so I can be not mic'd, we're good. Can you hear me at the back? Lovely. Hello, everyone. I get to talk about food, and I'm a little biased on this. I think it's the most important one, but I also think that it is one input of many. But we have a lot of power in what we eat. We choose every single thing that we put in our mouth. It's completely our choice. And it plays a part. It affects our body every single time we put food in it. That could be 3 times a day, that could be 5 times a day, and each time our body has to deal with whatever we put in our body. Sometimes that will increase our health and increase our nutrient base. Other times, our body has to deal with it. And it's all about balance. And so what we're going to talk about today is 3 main inputs that we can help create balance in our diet. But I'm also a big proponent about reality. I don't want you to think you have to do everything tomorrow and to be healthy. What I want you to do as well is to look at the reality of your diet today and pick something. Pick something in there that you feel drawn towards. You feel that this might be a challenge and I'm ready for the challenge, or something you just think would be easy, because then you can do it and try. And what's great about dietary changes is you get a great positive feedback. When you make one small change, you feel so much better, and so it's much easier to make the next small change. That's what I did. 10 years ago, my diet was atrocious. It was entirely white bread and Fruit Loops. I felt horrible. I couldn't think straight. My body was not functioning right. And all I did was made small changes, incredibly small changes. And sometimes those changes had 6 months in between them. But today I can say my diet is full of healthy whole foods. It works for me. My energy is balanced. My body is balanced. And so it took as long as it needed to. But it worked because I just kept making small changes. So when we go through here, don't feel you have to do all of it. Find a change that you want to do. And we need to do this. We are a culture of overweight and undernourished. This is a first in human history to have excess weight but undernourished. We don't have the nutrients. And it's because we've pulled these nutrients out of our food. 74% in the US have a suboptimal diet. I would say that's generous. And I would also say that we're very, very close to this. We can't say we're not the US. We live a very similar lifestyle and eat very similar foods. Our diet is incredibly high in processed food. We rush through eating. So say our diet was beautiful. It was full of vegetables. We had all the vegetables in the world to eat. We still eat it in our car, at our desk, in front of the TV. And when we're in the stress state, our digestive system doesn't work very well. We need to be relaxed for us to take in those nutrients. And that alone can make a world of difference. If that is the thing that you concentrate on, you'll get more nutrients from whatever you're eating. It's also really hard. So when you're cursing me in a few days, that's okay. Totally do it. Just keep moving through it. And then you'll see the difference and you'll notice how much better it feels. We also have an issue with the quality of our food. Our soil is poor, our crop handling is poor, our food travels long distance, and this significantly reduces nutrients. But that's not an excuse not to eat produce. Yeah, maybe kale had more nutrients in it 50 years ago, but we still don't eat enough kale. So until we eat enough kale, that's not even a conversation we need to have. We just need to get these nutrients in the first place. So we're going to be looking at the three big things that we can do. And each one of these creates balance, and whichever one you pick, you'll help balance the other two. They all are interconnected. So I might be separating them, but believe me, they all work together. So we're going to be looking at balancing blood sugar, because the insulin response, high insulin levels are connected to every chronic illness, including cancer. So we want to make sure that our insulin levels are as balanced as possible. We want to reduce inflammatory foods because the chronic inflammation or the inflammatory problem we all seem to have is creating a lot of chronic illness. And we want to increase the antioxidants in our diet to reduce that oxidative stress. There's oxidative stress that we have in our life, but we can help balance it by the diet we take in. We can also create oxidative stress with the diet that we have. So we can either help balance this or we can help unbalance this. So first we're going to look at blood sugar. This is a big one. In my practice, I see unbalanced blood sugar all the time. And you might have gone to your doctor and had a blood sugar test or a hemoglobin A1C test and it come back perfectly fine. And that's fantastic. That doesn't mean you might not have a blood sugar issue. Many of us will have decades of blood sugar symptoms before the mechanism breaks down and we see it in a blood test. So this is important for all of us to think about. Balanced blood sugar is a wonderful place. Your energy is steady all day. You can go 3 or 4 hours without eating. I can go 6 now. I used to go half an hour. And you crave healthy food. I can honestly tell you, I crave broccoli. I crave sweet potatoes. These are trustworthy cravings. When I crave broccoli, I need broccoli. I can really go with what my body is saying. But when your blood sugar is imbalanced, your cravings are not trustworthy. You're craving the wrong kinds of food. First of all, your energy is up and down. If you can answer the question, when is your energy the highest and when is your energy the lowest each day, then your blood sugar is up and down, because then you're having these fluctuations. For many of us, it's high in the morning and crashes at 3 p.m. That's a blood sugar crash, and that blood sugar crash actually came from breakfast. So we'll be talking about that as well. You're hungry really quickly. You're hungry within 2 hours of eating, and this hunger is demanding, it's emotional, and it changes your personality at times. Blood sugar hunger is incredibly immediate. You need to solve it right now. Balanced blood sugar, you have a few hours. When you feel hungry, you can actually go hours without eating and it's totally fine. So think about that for a second. If you get home from work and your blood sugar's steady and you have a good couple hours before you really need to eat something, what would your dinner look like? Versus you come home from work and your blood sugar's crashing and you're craving sweet and carb foods because that's what brings your blood sugar up quickly. What happens? For most of us, we open up the cupboards and eat everything out of it. Or we're driving home and we pull into the drive-thru. We need something quick and immediate. So when we have balanced blood sugar, our diet changes right off the bat because we want to eat those healthy foods. They become more attractive. But when we're dealing with these ups and downs, these cravings for sweet and high-carb foods are so immediate and strong, it's really, really hard to choose anything else. So how do we balance your blood sugar? The first one is to be honest with yourself. Keep a food diary and keep track of how food makes you feel. It's as simple as that. Do you feel tired or energetic after eating? Do you have great energy all day, or do you feel these big, big crashes? Do you feel the angry hungries? Do you feel impatient? Do you feel hunger is being demanding? Write those down. And take a look at it as a whole picture. Because many of us don't look at our diet outside of the meal we're eating right now. We don't look at the full picture. So it's hard to see that 3 p.m. crash being connected to breakfast, though in almost every case it is, because we don't connect these. I did my first food diary about 6 years ago when I was in school for nutrition. And at this point, my diet had changed quite dramatically. I was really cocky. I thought my diet was so fantastic, and I didn't need to do this food diary. I was fine. But then I thought, it's only fair if I'm going to have somebody do a food diary, I need to know what this process is. And there's nothing in my practice that I have my clients do that I haven't done myself, because I need to know what it's like. And I'm really stubborn and I'm really slow, so I work out the big problems when I do it myself. And what I found in the first 2 days is that I hadn't eaten a vegetable yet. So this diet I thought was really healthy, and in comparison to how it was 4 years before, it was a lot better. But I was shocked with the lack of vegetables. And what I found over the course of just keeping a food diary for a week is that I started seeing that running tally of vegetables. And when you think about vegetables, it squeezes out unhealthy stuff. And so still to this day, I have a running tally of how many servings of vegetables I've had. And that decides what my dinner is. So if I've had vegetables for breakfast and lunch, dinner is a bit more free. But if I haven't, then that's my concentration. And it's not this guilty thing. I don't feel I have to do this. I just feel I want to do this. And it's from this running tally. Be honest. The next one is removing refined sugar and flour, particularly sugar that you're drinking. When you drink sugar, your body doesn't recognize it as food. It doesn't notice that you've intaked any calories, but your blood sugar spikes. And there's no way of balancing it out. Every time your blood sugar spikes, the only thing that can happen is it crashes, and it's the crashes that we feel. So we want to get rid of these spikes because this is where the insulin level gets the highest. So removing the refined sugars out of your diet make a world of difference, and the refined flours. But that doesn't mean you can't eat sweet things. I still love sweet things. I still have something sweet in my diet every day. But it's a healthy sweetener. It's raw, unprocessed honey. It's maple syrup. It's coconut sugar. And to be honest, I don't miss the refined sugars. I actually don't like the taste of them anymore. When you make this change, your body rewards you by saying, great, this is better. I don't like that. Don't eat it anymore. And you don't have a taste for it anymore. It works wonders. And so just look at where you can replace your sugars. The first place would be if you like sugar in your coffee, put a bit of honey in it instead. If you're drinking sugary drinks through the day, work at removing those. You'll see a world of difference. Then look at your food. Last but not least is looking at breakfast. And you want a good, healthy protein and fat in your breakfast. One of the best breakfasts I've seen right across the board is an unhomogenized, organic, whole milk yogurt, full fat, full fat. The fat in dairy balances your blood sugar. This has good protein and this has good fat. And protein and fat slow down the absorbency of the sugars into your bloodstream. So you can sweeten this with honey, and you won't have a blood sugar spike. You can add some fruit to it. You can add some granola to it. It's a lovely, lovely breakfast. If you don't like yogurt or you don't tolerate dairy, good quality pastured eggs with some sprouted grain toast. It makes a wonderful breakfast. Just be honest with yourself. What breakfasts make you feel good for the rest of the day, and which ones create sugar cravings for the rest of the day? And you'll find really quickly which ones work for you. And all you need is 1 or 2, maybe 3 breakfasts that really work for you, and you're set. And then you don't want anything else because they make you feel really good. The next one is improving the fat in your diet. Inflammation is won or lost in the body in regards to the quality of fat. There are other inputs when it comes to inflammation, but fats are a big key. So out of your diet comes the processed fats. Any fat that's really far away from how it is naturally. So that would be the healthy margarines. Any fat that was liquid at room temperature is now solid at room temperature. This is not a good quality fat. Conventionally grown meat have very inflammatory fats. Any of these processed fats, then replace them. One of my favorite fats. Oh, I have a love affair with organic butter. Butter is glorious. Butter is wonderful. And organic butter actually contains 2 really healthy fats. CLA, which is a conjugated linoleic acid, an essential fat, and butyric acid, also an essential fat. These have anti-cancer agents in them. And it's just lovely stuff. It makes food taste better. And adding good quality fat reduces inflammation and slows down the sugar getting into your bloodstream, so it helps your blood sugar as well. I love extra virgin olive oil, mostly because we've been able to get olive oil for hundreds of years. Getting oil out of an olive is really quite easy. Getting oil out of a rapeseed or how we get canola oil out of rapeseeds is incredibly difficult. So getting the easiest to create oils are the healthiest oils. Coconut oil is also fantastic. It's not going to save the world, unlike all of the websites that say that this is the only healthy oil. It is a healthy oil, but it's just one of them. If you don't like coconut oil, don't eat coconut oil. If you like coconut oil, you don't need to take it by the tablespoon, but incorporate it into your life. It makes great chicken. There's some really great ways to cook with this. Nuts and seeds, avocado, these are natural natural fats, and these raw fats also contain the enzymes that you need to digest them, and you only get them from these raw whole food forms. Grass-fed and grass-finished meats, which you can find here at Nature's Fair, are lovely, lovely foods. We want to keep our animal protein lower, but up the quality. When a cow is fed grains, a diet it's not meant to eat, the same thing happens to them as it happens to us when we eat a diet we're not supposed to eat, a high refined, high sugar diet. We get inflamed, they get inflamed. Their body just can't handle it. And when we consume this inflamed body, it creates inflammatory fats. Grass-fed, grass-finished meats are animals that are fed their proper diet. They are balanced in health. They are healthy animals. They're happier animals. And because of that, they give us higher nutrients. They are healthier for us. So meat can be an absolute part of a healthy diet. We just want to up the quality, lower the amount. Nobody can digest an 8-ounce steak, let alone a 20-ounce steak. 4-ounce steak, that's an actual serving. Half a chicken breast, that's a serving. So we're taking in too much, and that's where the imbalance is coming from. We just need to balance that out. We also want to increase the antioxidants in your diet. So I'm a nutritionist. I'm going to tell you at some point, eat lots of vegetables. So 8 to 10 servings of fruits and vegetables is a healing, healthy diet. But I want you to be honest with yourself and just look at your diet and say, I am currently having blah number of vegetables. Could be 0, it could be 7. Whatever it is, tomorrow add 1 more. And then in 3 or 4 months or in a week or 2, whatever feels comfortable, add another. And before you know it, you'll be at 6 or 7 at least. That getting up to 8 can happen if you do this slowly. And what this does, by concentrating on adding, it squishes out all the other unhealthy food. So you don't need to be concentrating on what to remove all the time. Instead, concentrate on what to add. Where can I add another serving of fruit? Where can I add another serving of vegetables? And you will honestly eat better simply for it. Eat a rainbow of colors as well. Every color has amazing antioxidants, and each one of them is protective. We know about certain ones. We've done studies on certain ones, but they're all really good for us. But we tend to get really stuck in ruts. We buy exactly the same vegetables all the time. So there's a rule in my house. Every January or February, when we get really stuck in nutritional ruts, because the farmer's market's not on, my garden isn't growing. So what we do, my partner and I, is we set a rule that every week when we go grocery shopping, we must buy one fruit or vegetable we've never bought before, just for 2 months. So that turns into 8 new fruits or vegetables. Usually in that time, 1 or 2 stick. 1 or 2 are ones that we really, really like. There's usually 1 or 2 we'll never buy again, and 5 or 6 that, they're good, but they just don't get into the habits. But what it's done over the course of just 2 years is increased our diet's variety by a long shot. And this is an easy thing to do. You don't need to do it all the time, just do it for a set period of time. Herbs and spices are also incredibly good for us. They are protective, they're antioxidants, they're anti-inflammatory, they make our food taste good. Healthy food tastes really good. Really, really good. And we can use spices for this. Rosemary, which grows beautifully here in the Okanagan all summer, and most of the winter. Mine just died about a month ago. When you marinate your meat with rosemary, it protects the meat against the carcinogens that are created when you grill it. So you're able to create higher health simply by making it taste better. Add garlic, add some lemon juice, that increases it even further. And oh man, this smells really good. Spices like turmeric, and Dr. Schnurr will be talking about that even further in a bit, is a potent anti-inflammatory spice and a potent antioxidant. Sprinkle it on your food. I've experimented with how many places could I possibly put turmeric. Sprinkled on eggs is wonderful. You can throw it into tomato sauce and not taste it at all. Then there's the curries. And when you mix turmeric with cumin, ginger, and or black pepper, you increase your absorbency by 3 times, simply by making it taste better. So in my pasta sauce, I have turmeric and garlic and black pepper and whatever other spices I want, so I get that higher potency. And in my soups and stews, I usually do turmeric, paprika, and cumin, which makes a lovely flavor, but increases the absorbency of all of them. These are all really good for you. Ginger, garlic, and onions are great for your liver. Black pepper helps support your stomach and helps increase stomach acid. Cinnamon helps balance your blood sugar. These are the things that we know about these foods. Give it 10 more years and I'll have a longer list. It's food. It's good for you. Eat it. We don't need to know this is the reason why. And if you don't like one of these, find another one. If you have blood sugar issues but hate cinnamon, don't eat cinnamon. Find another one. These are all really good for you. And there's a lot of studies to show this. So my theory is always just eat food, but sometimes it's nice to see the studies. This first one is a really interesting one. They took a group of men, and for 12 months, they ate 5 to 6 cups of broccoli a day. This is the equivalent of like 8 or 9 servings of broccoli in a day, so this was a very determined group. I can't say most of us will do this, but it showed amazing results. What they found is the men who ate this broccoli-rich diet for 1 year showed genetic changes that were protective against inflammation and prostate cancer, changed their genes simply by the food that they ate. They've also looked at lycopene, which is the red color in tomatoes, and they found that it's incredibly protective against prostate cancer. Tomato paste is the most concentrated form of lycopene. Tomatoes release their lycopene when they're cooked. This is why both raw and cooked food is good for you, because each have different properties, and lycopene is better in cooked tomatoes. And it's concentrated in tomato paste. But a very important thing is that you get it in a glass jar, because when tomatoes are in metal jars, cans, they are very acidic, and that the BPA, or the plastic on the inside, seeps into the tomatoes. So what's really nice is here at Nature's Fair is they have them in glass containers. So increasing tomato paste, having pastas with tomato sauce, it's lovely stuff and can help reduce the risk of prostate cancer. And you want a bit of fat with this, because lycopene is a fat-soluble antioxidant. When our diet is balanced, when we have all of the main macronutrients, when we haven't decided not to eat one of them, like we haven't gone off fat or carbs or protein, our body is balanced and we're able to get all the nutrients from our food. I really wish this was true. Food is healing, food is medicine, and we can use it to help heal us. No matter what state of health you're in. If you're in a very weakened health state, food can help bring your energy up, can bring up your just sense of well-being. If you're already healthy, it can keep you healthier, it can keep your body balanced. So don't forget about that when you're not feeling well. Think about as well what food you're putting in. I also get to talk about exercise, because as another input we have full control over is our ability to move. And this is the best photo of what our culture is like. He's sitting on a chair while walking his dog on a treadmill. For those of you who can't see it at the back, it's really incredible. We aren't moving, as well as we see going to the gym as something that we need to do. It's something on our to-do list, so much so that they're taking the escalator into the gym. That exercising into the gym isn't necessary. And I'm not a gym goer. I think gyms are fantastic if you like going to the gym, but that's not an excuse for me not to exercise just because I don't like that atmosphere. I prefer getting my exercise in my day, because then it's not on my to-do list. My to-do list is long enough. And we can get this exercise, we can get enough exercise quite easily simply by making small little changes. Because what you're going to see is that you don't need a ton of exercise. But the benefits of exercise is that it increases your intake of oxygen. It increases your breathing. When we're stressed, we breathe really shallowly, and our oxygen levels go down, and we don't think as well. So exercise forces us to breathe deeper. It increases your circulation and improves your cardiovascular fitness. Of course, we know that one. Improves your muscle strength, and when your muscles are stronger, your bones are stronger. Increases the circulation of your lymphatic system. And this is where your immune system lives. This is where your body detoxifies. And unlike your circulatory system that has the heart to pump it, your lymphatic system doesn't have a pump. It actually moves when your muscles move. It uses the movement of your muscles to move itself. So when we sit all day, when we're sedentary all day, our lymphatic system isn't throwing out the garbage as well as it could. It's not moving our lymph. Light sweat helps the body detoxify. It increases brain endorphins. You don't feel great, you go exercise and you feel better. Your mood goes higher. It reduces your blood sugar levels and insulin, and it promotes stress reduction. Exercise will get you out of that fight or flight, that stress state. But it doesn't take a lot. All we need is about 30 minutes of moderate exercise per day. That's not a lot. So instead of thinking, okay, how am I going to put 30 minutes of exercise in my entirely busy day, I want you to think about it slightly differently. Can you limit sitting and sleeping to only 23.5 hours in a day? I think we all can. And sometimes it's not, and it doesn't need to be 30 minutes straight. It can be 3 10-minute walks. It can be parking on the far end of the parking lot all day and walking those 5 minutes each way to the car. Just move, let your body move. And there's quite a lot of studies that show the benefit of this. This one's really quite interesting because it takes into account all of the things we have control over. It looked at the Mediterranean diet, being physically active, moderate alcohol use, and non-smoking. And they looked at 70 to 90-year-olds. So this is never too late. And they looked at about 2,500 of them. It was a good chunk of people. And what they found, and they were looking at mortality from all causes, all chronic illness. And what they found was people that had a low adherence to those 4 patterns, had overall a 60% increase in all deaths, 64% from coronary heart disease, 61% from cardiovascular disease, and 60% from cancer. So these are all the things that we have control over, and this really shows what happens. But I really like this chart, because what they did is they put up on a chart the difference between those who didn't do anything, or even just one of them, versus the ones who did all 4. And look at the difference. But look at the difference between 1 and 2. So this is not over a huge burden, it's just increasing those 2. As well as, look over here, how it takes a little while before you even see the slope off. So you don't always see the difference right away. It's in the long term that we see these benefits. And when we incorporate 3 or 4 of them, we get a much bigger difference. It's quite remarkable. We work in cancer, so we're always looking at cancer studies. And what they found was exercise lowered the risk of breast cancer recurrence. And that's at 3 to 5 hours a week was the highest one, 50%. And oddly, over 5 hours, it was only 44%. But this could be the oxidative stress that happens when we have more exercise. And if our diet isn't balancing that out, that can lower the risk. But what this really shows is that it's 3 to 5 hours. That's less than a half an hour a day. And that's a significant decrease. They also looked at men that were just not looking just at women. And they found men with a modest amount of activities and a variety of such at just over 3 hours a week had a 61% reduction in prostate cancer death versus those who had less than an hour. This is significant. This is simply movement. Now we go over back to Joe for stress reduction.
Thank you, Lisa. And so, again, stress reduction, like I say, the psychosocial aspects that we don't often have time to talk about in offices play such an important role in our health and well-being. And it's not just what we think and feel, it's how long we think it and feel it. So acute stress is not necessarily a bad thing for us. In fact, it can be a good thing for us. Acute stress has even been shown, in fact, our immune system is a little more activated then. But it's that chronic stress, it's that day-to-day, month after month, year after year stress that starts to really affect our body big time. It does suppress our immune system. It does drive our blood sugars up. It does create inflammation and all these kinds of things, and create dysfunction in our hormones as well. So we want to address what it is that's creating that stress and how to deal with it. And we look at there's 2 systems of balance in our stresses. We have the stress system, which is the sympathetic drive. We have the relaxation response, which is the parasympathetic. And really, it's like yin and yang. You're going to have a movement between one and the other, but ideally we want balance in those 2 systems. And we'll see, like in the animal kingdom, yes, they get stressed as well too. I mean, who wouldn't? I mean, if a lion was chasing me and was going to eat me, I'd be stressed. And but in the animal world, what they find is that after that initial stress, the zebra goes back to kind of eating grass with the herd and sort of forgetting all about it. And it's not like humans that would then start to, every time they hear the bush rattle or something like this, they're looking around, or waking up at night, in a cold sweat, having these bad dreams about these lions and that kind of thing. And in fact, a big part of the human stress-related disease is from the high percentage of time that humans are spent in this sympathetic response, dominant state. And so we want to try and turn that down or off and encourage more of that parasympathetic, that relaxation state. And interesting, in the last couple of years, going to some of these conferences, what I wasn't aware of and learned and was very amazed by, but it tends to make sense, and I think the Chinese have known this for a long time. They've talked about heart-centered medicine, in that the heart and brain have communication. We always think about of course, the brain sending signals down. There's fear; it gets our heart beating fast. Certainly, that's the case. We're seeing here brain sending signals down, but there's actually more information being sent from the heart to the brain than there is vice versa. And so that's really powerful. It means then that when we spend more time in this center than we are in this center, we're sending more healthy information to our brain and to the rest of our body, because of course our brain is communicating with the rest of our body as well too. And so the heart is sending signals that affect the brain centers, especially involved in things like decision making, in creativity and emotional experience. And so in those kind of situations, when we're in fact faced with some difficult decisions, the best thing to do is actually take some quiet time just to get into this space so that we can get that part of our brain activated and we come to better decisions than when we're in this space back here, our reptilian brain, that isn't very good at decision making. And we'll talk about ways how you can get into that space. And things like singing, dancing, laughing, having some fun. It's amazing how often in my practice, when I ask patients, and this always surprises them, I'll say, so how often do you laugh? Tell me when you last laughed. And they'll look at me and they're puzzled, and it's kind of like, oh, I don't know, maybe a couple of days ago. Oh no, maybe that was just a snicker. Like, do you mean a real laugh? And it's just they're really puzzled as to why that's of interest. And we know that we always hear the phrase laughter is the best medicine, and there are studies that show that in fact that's the case. There are studies that show that people who are laughing more, they raise their natural killer cell activity, and natural killer cell is one of our ways to in fact kill cancer cells. We look at a study then that came out of Norway. This is a city of about 66,000 people, and they were followed up for 7 years. They were assessed for their humor index. And so what they found was that people who scored in the top quarter of that humor appreciation were 35% less likely to die during that period of time. And when they then looked at in those residents who had cancer, that was about 2,000 of them, that those who again were in that top quarter were 70% less likely to die in that 7 years than those who were in the bottom quarter. And so again, the only difference, and this didn't depend on what the cancer stage or type was, the only difference was that these people laughed a lot more. And so again, that healing nature of laughter, so important. So, you know, spend time with people, in the company of people who make you laugh. Rent a funny movie. Tell jokes, or share jokes with others, and make them laugh as well too. So attitude it becomes very important in the way that we handle our stress. The idea of the Taoist or Buddhism, the smiling outwardly and inwardly. And when we smile outwardly, it creates kind of an inner peace. And when we're smiling inwardly, we also have that outward piece that others can pick up on. I mean, and we see the reverse of that as well too. I mean, we're all familiar when you walk into a room and there's just that feeling that, oh, something really, something's gone on in here in this room where people are just not really happy. It's that sense of that angst and anger that goes out and that's projected outwards. Letting go of resentments, practicing gratitude and forgiveness, practicing some form of meditation, whether it is mindfulness-based stress reduction, yoga, transcendental meditation, prayer. All of these things, like, it's amazing. It can be dancing. It can be sitting, by a lake and just watching the water. It can be watching, sitting in your garden and just looking at the beauty of the garden and the beauty of nature. These are all forms of meditation. In fact, it's so surprising when I ask people, do you practice any form of meditation? No, I don't. I don't go into that kind of stuff. That's too like, Middle Eastern or too far east for that. But then I say, well, do you pray? Oh yeah, of course I do. Do you go for walks and just kind of feel relaxed? Do you sit in a bathtub, listen to some relaxing music? Oh yeah. Well, those are all forms of meditation, and we're going to show pretty soon that it doesn't matter what form of meditation you do, whatever works for you, it has great benefits. Associating with supportive people, breathing. Is so important, and in fact it is one of the most important. It's the first thing that we do when we come into life, and it's the last thing we do when we leave life. And it's something that's portable. It's something that doesn't cost us anything to do, and yet it has a very profound impact on our health. When we're breathing up in our chest, that's a constricted breath. That's more that sympathetic drive. When we're breathing down in our belly, that's more that relaxation parasympathetic. And in fact, a very simple technique I teach all my patients who have high blood pressure or women who have hot flashes, menopausal symptoms, and for a host of other things, sleeping disorders, is a very simple technique called paced breathing. This has been studied as well too. The literature has shown that there are benefits from this. It does lower blood pressure, in fact, as good as any blood pressure medication does. And this is a very simple technique, and I'm taking 30 seconds to show you right now. So basically what we're doing in that paced breathing, I usually get people to put their hands on their belly so that they can feel that they're breathing into their belly. And so you breathe in through your nose. Now, if you have nasal constriction or obstruction, just breathe in through your mouth. But you breathe in through your nose over 2 to 4 seconds. So we're breathing in, 2 to 4 seconds in, and then we breathe out over 5 to 6 seconds. Also breathing out through our nose as well too. And that is the whole technique for paced breathing. So it's breath in over 2 to 4 seconds and out over 5 to 6 seconds. And so maybe you might need a second-hand clock just to get an idea what that's like. But then afterwards, I just sit there and I'll just do it with my eyes closed. Our minds tend to wander, and then what you can do is just think about the belly rising and falling, or the air coming in and out of your nose. Letting those thoughts just kind of drift like clouds, not judging them, just coming back to that feeling of the belly rising or the air moving in through your nose. If you do it for the whole key to this is you have to do it for 10 to 15 minutes at one time, where you won't be interrupted. And we need that because we all know that if we're anxious or something like that, so we take a couple of deep breaths like that, we feel pretty relaxed. But that's not enough to turn off our sympathetic drive and turn on our parasympathetic drive. If you do it for 10 to 15 minutes, that is going to have that change, and that has those profound effects then in terms of improving our immune response. And then, as Lisa said, taking our time to eat and enjoy your food. And then there are many, many studies showing about the benefits of these very things. I like this study because, some people will say, oh, well, to have any benefit from doing this kind of thing, you have to be a yogi master or something like this and have practiced for many, many years to get any benefits. But this study showed that, in fact, that wasn't the case at all. It was a study, 19 long-term practitioners of various types of meditation, prayer, yoga, meditation, 19 short-term. So they'd only done 8 weeks of some type of relaxation training, and then 20 controls. And their blood was tested for gene profiles, and what they found was that relaxation elicited these genetic changes and expressions that had benefits on the negative impacts of stress in both short-term and long-term practitioners. So again, we're talking epigenetic modifiers. This is a positive epigenetic modifier, just simply through doing some kind of relaxation meditation type of thing. And these gene pattern changes occurred, it didn't matter what type that you did as well too. So find something that you like to do and then just do it. Some of the studies on paced breathing show that you didn't even have to do it every day. The ones that lowered blood pressure 4 times a week, and they maintain that lower blood pressure. And so unless somebody's coming in with sky high blood pressure that I'm worried that might have a stroke, I always would now teach my patients is paced breathing first to see whether that's going to work in lowering their blood pressure. And that worked in many, many patients. The benefits, two or three for that, is that number one, they're not going to spend a lot of money on medication. Number two, they're not going to have side effects from those medications. And number three, when we're bringing down that stress response, it's going to have spin-offs in other health problems as well too. And this was a study about psychological interventions, so support groups. This was 227 women with breast cancer, and they followed up for 11 years. Now, half the group went into a support group where they were shared learning, and the other half just did the regular kind of care. What they found after 11 years that there was 45% less recurrence and 56% less cancer-related deaths in those who were part of that support group. So again, these are phenomenal numbers. And And what they found was that when they interviewed these women, that they found that being part of this group, it helped their mood. They felt less stressed. They helped one another kind of stick to these sometimes difficult dietary plans that Lisa is trying to force upon you. No, I'm just... Yeah. And what another interesting part was that there was further reduction of risk of death from all causes and improvement in all secondary outcomes. And so again, it just isn't affecting just their cancer. It's affecting all these other things. And why? Because again, we're addressing the underlying mechanisms that are creating ill health. And sleep. Sleep cancer, very related as well too. The World Health Organization has now listed light at night exposure as being a likely carcinogen. So anybody with cancer should not be doing shift work, should not be up at night working. So there's been more and more studies showing that it's melatonin, a hormone that our brain produces at nighttime, that has so many benefits. I mean, it not only has anti-cancer benefits, it has antioxidant, anti-inflammatory benefits. It helps our hormones talk to one another better. That's why it has that effect on things like obesity as well too. And so the idea of getting uninterrupted darkness at nighttime is very important. So, turning off that that TV in our bedrooms and not letting it go all night is very important. Night lights are going to be fine. It has to be bright light exposure. So, don't turn everything off and then trip on your way to the bathroom and hurt yourself, because we don't want to create another problem like we showed on that other slide. And this is also not the way to get your sleep either, because if I'm on the road and that's what this guy is doing, it's going to create some problems here. And then questions about supplements, and again, that could take all night as well too, just talking about supplements. I'm going to be very brief about this, and I can certainly take questions if people are interested in that as well too. But what I want to say, just a few statements about supplements. Number one, it's not a substitute for a good diet. A good diet is still the best way to get all the kind of healthy nutrients and foods that our body needs. There are times, though, where supplements may be very beneficial. And so in terms of people who have illnesses, we know that there are often increased demands for a lot of their nutrients and minerals. They may, in fact, have decreased intake or absorption. And so studies that have shown people with inflammatory bowel disease, like Crohn's or colitis, are deficient in many, many different vitamins and minerals. But they have to be patient-specific as well, too, because not everyone will benefit from certain supplements and herbs, because they may have, and this is where it's important to know the history of that individual. What other medications are they on? What is their health history? Have they had other health problems in the past? I'm not going to put somebody who has high blood pressure on something like licorice or ginseng, because it can, in fact, raise their blood pressure. If somebody's got a history of gallstones or gallbladder disease, I'm not going to use green tea. So again, you have to know kind of what conditions and other kinds of things are going on in that individual and other medications. And so that's where getting some health practitioner guidance is very important. I want to talk just about a couple, 3 or 4, very quickly. Vitamin D, probably one of the most important. And this is where it's really important, I think, all of us to know what our vitamin D levels are. And I would encourage you all to ask your family doctor, let me get a vitamin D level. And if they say, oh, well, just take 1,000 units, that's all you need. The problem is that's just not the case, because I have some patients that 1,000 units is just fine, but I have other patients where they need to take 12,000 units to get their blood level up to a reasonable level. And what's a reasonable level? The average Canadian sits, and this was a study actually done by a group of Canadians, that showed that the average Canadian level is 67 nanomoles, so that's too low. That's not what we need. It's below normal. The benefits of just increasing that level to 105 nanomoles per liter showed 37,000 fewer deaths per year. Amazing, 37,000 fewer deaths just by raising vitamin D levels alone. saving $14.4 billion less the cost of the program. So this is an enormous impact just by simply, if we could get every Canadian's vitamin D level up. Now, having said that, not absolutely everybody can take vitamin D, and there are some exceptions to that. But it's something that certainly, again, we want to know, and then we want to know whether we're taking the right amount. And so, like I said, get it tested, get on some vitamin D if your level's low, have it retested. Is it getting up to that value or not? And we know that there are many studies showing vitamin D and calcium supplementation can reduce all cancer causes by 60%. Studies showing, again, vitamin D levels associated with 50% reduction in the incidence of breast cancer. I've also seen studies that show that women with breast cancer who have a higher level at the time of their diagnosis and then throughout treatment and for a longer period of follow-up actually have about a 50% reduction in terms of cancer recurrence and death as well too. So both important in terms of prevention and treatment. Fish oils very beneficial for our health as well too, and they're called essential fatty acids for that reason. Essential fatty. We don't make these, and so we have to take them in through our diet. And Lisa talked a little bit about that, and I won't go into much about this. It is very shown to be healthy for many different health problems. It has anti-inflammatory, antithrombotic, means it prevents blood clots. Again, not everybody can take them. If they're on blood thinners, they shouldn't be taking that. And again, if a person's eating, say 3 servings, about 12 ounces of a fatty fish like wild salmon a week, they're going to get all the omega-3s, the EPA and the DHA that they need. Curcumin from turmeric, again, as Lisa said, has anti-inflammatory properties. That's one of the probably key ones. Antioxidant, and it can act as an anti-cancer agent. In fact, in India, they used it as an anti-cancer agent for many years. Also, when we're looking at a whole bunch of different kind of studies showing that it has multiple benefits in different diseases. Does it mean everybody should be on curcumin? Well, some people would say yes. But again, using it liberally in your foods, I think, is very important. And in certain circumstances, if people have quite a bit of inflammation and say dietary changes and other things haven't been able to decrease that, then yes, I would say curcumin would be a great addition to that. Green tea, also very beneficial, very anti-inflammatory, a very good antioxidant, very good anti-cancer agent as well too. Studies showing that it's very beneficial in reducing recurrences in both ovarian cancer and colorectal cancer. And so in situations like that, those would be individuals I would certainly highly consider using green tea extracts, although just getting people to drink green tea is also of good benefit. Again, there are some exceptions to when people can't take green tea. This is a very interesting study by Dr. Ornish, who's a cardiologist. He's the first one to show that if you used a number of lifestyle interventions, you could actually reverse heart disease. And again, in his time when he was doing this, many of his colleagues thought he was really, really way out, and yet he proved that was exactly what could happen. And so then he also turned his attention to cancer, thinking, well, there are similar mechanisms. So he took 93 patients with early prostate cancer, and they were randomized, which means just by flip of a coin. One went into usual care, the other into healthy lifestyle changes. And so there were a number of healthy lifestyle changes: vegetarian diet, exercise, meditation, support groups, some supplements. They followed them for a year, and at the end of a year, this PSA, prostatic specific antigen, is a marker of prostate cancer. If it's going up, it means the cancer is getting worse. And so in that usual care, that's exactly what they saw, 6% average rise. 6 men needed to go on to surgery and radiation. In the healthy lifestyle changes, there was a 4% average decline in the PSA. So in fact, showing that the cancer was regressing, and none required any further surgery or radiation. So very, very important to look at embracing a number of these lifestyle, because they're synergistic, they work together. What was even more interesting as well, too, is that then he took blood from both these groups, put it in a petri dish that was growing prostate cancer cells. He found that the blood from the men who were in the lifestyle change group was able to inhibit the prostate cancer cell growth 8 times more powerfully than the blood from the men in the usual care. Again, powerful, powerful. And the thing that really strikes me about this is that it's in the blood. It's not just in the tissues that I mentioned surrounding the tumor itself, but it's actually in the blood, and that blood goes everywhere through our body, to every tissue, every cell, carrying with that those genetic signals to say, hey, get on track here. And so last little bit, I just want to touch just briefly on environmental chemicals, because this is near and dear to my heart as well, too. The problem is that we're just seeing so many more chemicals coming on our market every year. Too many, many that haven't ever been even regulated to begin with. It means, in other words, tested whether they're safe or harmful. And there's just so many that are coming on now that the government cannot keep up and do any adequate testing. So they are leaving it to the industry to tell us, if anything that they put on the market is harmful to us. And I'm sorry, but it's always, if somebody's got a profit, are you going to really say that something's harmful and risk offending your shareholders? So these chemicals show up in all kinds of things, from food and clothing, personal care products, even prescription drugs even, things like household cleaners, lawn care products, your Teflon pans and that type of thing. These are things we want to look at getting rid of. These organohalide persistent organic pollutants, and they're called POPs, persistent, because they stay in our system for a long time, in our environment for a long time. It takes a long time for them to degrade. Like as I mentioned, they're obesogenic. They're stored in our fat. They can create imbalance in our ability to detoxify, clear things out properly. And they can be toxic at even low levels. And that's one of the things industry keeps arguing, is that no, there's only a harm if they're at high levels. Well, even very low levels of something like bisphenol A that Lisa said you find in tin cans, for example, can be, in fact, damaging to a number of our endocrine systems. And so there's more and more studies showing that it can, in fact, affect how our thyroid is functioning. And one of the things I've seen over the last number of years is the rise in hypothyroidism. It's just, it's rampant. And I think it's because many of these chemicals are disrupting, how our hormones are functioning. So, again, there are many studies, this from Pediatrics 2010, showing that in kids who had ADHD, they were more likely to have higher levels of these organophosphate or pesticide blood levels or tissue levels than those who didn't have ADHD. So again, we're seeing more and more accounts of kids getting ADHD, and we're chalking it up to all kinds of things, behavioral problems and what have you, when in fact we need to also look at what's in our environment. Dick Irwin from Texas U has gone so far as to say chemicals now are replacing bacteria and viruses as one of our main threats to health. So what we can do to minimize the toxic exposure, again, this is not something where we have much influence over what's out there, but we can start to be proponents of saying, hey, maybe we don't want pesticides used in cosmetic lawn care anymore, and we can sign petitions that support that. And what we do have control over, though, is what we purchase. And so, just becoming informed consumers, what are some of the products that are harmful, and then looking at what can we use that's much safer. You can download this, a wallet-size one, from environmentaldefense.ca. I carry this in my wallet all the time because there's a lot of chemicals on here that potentially have some potential level of harm. And so I'm going to look for these. If they're in the products that I'm looking at, I'm going to switch to something else. And so a place like Nature's Fair, you're going to find lots of products there that are going to have things like shampoos and all this that are very beneficial. And we have A whole bunch of them right there. Soaps that don't have phthalates in them, and things like DMDM hydantoin, which are formaldehyde releasing agents. So these things we just don't want to kind of test our system any more than we have to. And part of it is a precautionary principle as well too. Now the industry will say, well, there's just not enough evidence that shows that these are really harmful to us. But the thing is that how long do we wait until we now have that amount of level of harm that we now take it off the market? So again, precautionary. If we can find alternatives, all the better. And we can. So things like Environmental Working Group, EWG.org, is a great site. It's got lots of good information all about things like the Dirty Dozen, which foods are highest in pesticides, also this cosmetic skincare database. Now the problem with the skincare database, though, is that it's American, so a lot of the products are not easy to find in Canada. LessToxicGuide.ca comes out of Nova Scotia, and it's got many that you'll find in stores like Nature's Fair here. So that's a useful one to look at. So in closing, I'll turn this over to Lisa. Oh, right here.
Is my mic on? So I'm just going to do a quick recap, and then we're going to open the floor up for questions. So this is top 10 things that come out of this presentation that you can bring home. First one is to relax and laugh. Take some time to get the stress out and laugh. And be that person to make your friends laugh, your family laugh, because you'll laugh with them. So it solves the problem right across the board. Get screened. Go to your family doctor. Get screened for cancer screenings on a regular basis, as well as have your levels tested, have your vitamin D level tested. Make sure that anything that might pop up in a blood test is looked at. And then let's pay attention to health outside of that. Be moderate or avoid alcohol. What I found, I love wine. We're in the Okanagan. I live here for a really good reason. And I found, though, that 2 glasses of wine in the evening set me up for sugar cravings the next day, but a half a glass of wine is totally fine. So, and a bit more moderate than that. So it's not about completely abstaining, but reducing the amount. Don't smoke. Avoid secondhand smoke. We know this. Be body aware. Listen and trust what your body is telling you. We tend, as a culture, to have cut our heads off. We think we don't feel. And in my practice, I spend a lot of time with a lot of my clients just having them feel symptoms again, so they know what's going on. And when you feel it, listen to it and try to find what's going on. Avoid toxins, especially the ones that you can control. There's many options around here of non-toxic personal care products, but also household cleaning products. Vinegar and water, baking soda, they work really, really well and really reduce the amount of toxins in your environment. Take some vitamin D and get some sun. It's very soon, we're really close to summertime where sunshine. But until then, we need some vitamin D. We do live in Canada. Sunlight on the skin for 15 to 20 minutes every day. That's all we need, but most of us don't get that. Exercise regularly and maintain a healthy body weight, so it's just 30 minutes a day. Limiting the sitting and sleeping to only 23 and a half hours. So exercise 30 minutes, only sit for 23. Eat a healthy diet. So moderately, a very good healthy diet is 5 to 6 servings of vegetables. A very healing diet is 8 to 10. And look at what can you do to improve that. And have a balance between cooked vegetables and raw vegetables. They both have benefits. In particular, cook your tomatoes. Eat less red meat and no processed meat. So lower the amount, increase the quality, and aim for local and organic, which we can do here. The farms are everywhere. We have organic food here. And last but not least, share your love. This is a gateway to happiness. Share your love. The more you give, the more you receive. And it's much easier to relax. It's much easier to avoid stress. It's much easier to take care of yourself when you can feel the love. And that's everything. So Dr. Schnurr and I would love to take your questions. I'm going to get my water. Yes?
What is a serving?
Oh, that's a great question. So the question is, what is a serving? For vegetables, first of all, eat them. Don't worry about counting. But if we're looking to count just to get an idea, your hand, one hand, is raw vegetables. Sorry, this is cooked vegetables is 1 hand, raw vegetables is 2. So it's half a cup. But it's easier doing that. And if your hands are bigger, your serving is bigger. If your hands are smaller, your serving is smaller. There's a question at the front.
I see from your brochure that you do only cancer. I wanted to take several away and give to other people that they don't necessarily have cancer. Can they still come to see you?
At our center, InspireHealth was founded by the government, provided funding by the government to provide only cancer care. And so sadly at this point, not yet. We can only see people who have a diagnosis of cancer. But that's part of why we love when we get invited to functions like this by Nature's Fair, but it gives us an opportunity then to reach out to the public to look at prevention, because really that's near and dear to my heart as well too, because all of these things, and that's why we retitle it from just cancer care to really chronic illness care, because they really are all the kind of mechanisms that are creating that can lead to cancer can also lead to many other diseases, and so we want to address those as well too. And prevention is really, if we can prevent these chronic illnesses and prevent cancer, then we're doing even a better job. And so, but sadly, no, at this point yet, no, we're still just strictly a cancer care center.
We do, Mark. We do have an online question from one of our online viewers. The question is red fife healthier than white or wheat flour?
Shall I take that one? So red fife wheat is an old version of wheat. It hasn't been changed. One of the reasons that wheat has become problematic is twofold. One, we eat it too much. We have it 5 or 6 times a day, and we've changed it. Wheat today is very different than wheat 50 years ago. It makes bread that's much more fluffy, and that's the gluten, so it has a much higher gluten content. Red fife wheat, which is now fairly available in the Okanagan, is an old form of wheat before these changes have happened. So to say it's healthier, it depends on what your definition of healthier is. I like it because it's different and the gluten level is lower. But if you're sensitive to gluten, if you're sensitive to wheat, it's still a wheat product. It will still create the same kind of symptoms, but it's a great alternative, and it makes fantastic bread if you know how to properly ferment things, which I don't. There's people in the valley that do, and it makes beautiful bread.
We have another online question. Okay. Sorry, just to take that while the people are still online. Does the InspireHealth Clinic do blood testing when you come in for your consultation, or do you have to have that blood work done before you come into the clinic?
No, if it were things like if they're asking about blood testing like vitamin D, for example, those would be things that we could certainly do. If they haven't had it done by their family doctor, no, then we would certainly arrange, we would do that ourselves. There are oftentimes a couple other tests that I generally like to do as well too. Again, and these I'll throw out. Always not a bad idea to know what your high sensitive C-reactive protein is like, because this is a marker of inflammation. I know we talk about it as a marker, especially for heart disease, but it is a general marker of inflammation. And anything higher than 3 means that we should start to look at, are we eating a more anti-inflammatory diet or a little bit more pro-inflammatory, and look at other things that might be contributing to inflammation. And so that high sensitive CRP is very good, as well as I do like to do a hemoglobin A1C that is a check of blood sugar, because again, just a spot blood sugar or fasting blood sugar might miss it because it does fluctuate so much from day to day. This is a test that marks what your blood sugar is like over the last 3 months. And so it gives us a better average of is the person's blood sugar tends to be on the higher side or not. And so it is a useful test, especially in individuals. If they have chronic disease, if they have cancer, those are ones that I think are very important, because there are studies that show if we can bring those levels down into a more ideal range, there's less potential for cancer recurrence.
There's a woman at the very back. The long hair. Yeah.
I had a question about sleep habits, proper sleeping habits. What would you say is a good night's sleep? Because for myself, I will do 4 to 6 hours, and then I'm ready to rock and roll for the day. So, what is a good, and how do you promote a healthy sleeping habits?
Well, again, the studies that I've seen in terms of getting the adequate amount of melatonin production, you generally need around about 7 hours. Now, the interesting thing is that, and I always thought it had to be sleep as well too, but they showed in studies that people who stayed in a dark room at nighttime and didn't get up still produced as much melatonin as those who slept that entire time as well too. So it's actually not sleep per se that affects the melatonin production. It's actually that exposure to light. And that melatonin is particularly helpful. Now, of course, we do know, though, that sleep is still really beneficial, and otherwise you fall asleep at the wheel like that individual there in that picture. And there are studies that show that people are more prone to accidents if they don't get adequate amount of sleep, and prone to other health problems as well, too. So there are lists everywhere about sleep hygiene. One of the first things I would recommend people do is try to get to bed earlier. Though, I mean, we tend to get to bed late all the time, and we're busy doing this and that, and usually if we can get to bed around, and I know this sounds early, 10 o'clock, 10:30, then that's when we're getting some really good quality sleep, especially if we're sleeping that before midnight or producing even more melatonin. But part of that also means we have to shut down, our electronics. The blue light from TVs, from computer screens, they're signaling kind of our brain that, hey, it's still daylight. So we're not getting that peak production of melatonin at nighttime. We shut that down about an hour or so earlier, kind of dim the lights a little bit, kind of get into things, the routine that, just kind of wind our day down. Maybe it's just some like it might be a warm bath. Now, again, everybody has to some people might find a warm bath before bed stimulating and then get too wide awake. Some might find reading before bed relaxing. I always found that if I read one of my medical textbooks, I wouldn't last 5 minutes. I'd be out. But then if I got a really interesting novel, I'd be up till 1 in the morning, and I just couldn't put it down. And so, again, if going to maybe one of those used bookstores, buying some of those old medical journals, I might do the trick for you too. But finding what routine works for you as well, and then generally, also, again, like I said, if falling asleep is a problem, say because of our mind's too active, engaging in some of that kind of meditation, whatever form works for you, whether it's a prayer, whether it's that paced breathing, doing that for 10 to 15 minutes. Things like progressive relaxation and those types of things have been shown to be very beneficial. So those kinds of things can be very helpful.
Years ago, Veer Shute told me that coconut oil was as good for a sunscreen as anything you could use. What's your feeling on sunscreens? Because my skin hates them. It likes coconut oil, but it doesn't like sunscreens.
Well, I can address about how good coconut oil is as a sunscreen. I must say I don't think I've ever heard of it used as a sunscreen.
I've tried it. It gives mild protection.
Okay. I think that that we do want a little bit of sun exposure, and so they do talk about, given, even the dermatologists are recommending 15 minutes of sun exposure to stimulate that vitamin D metabolism. But having said that, in Canada, that's not going to get your vitamin D levels up to that 100. I'll tell you right now, it's not going to do it. Now, different if you were in the Caribbean, yes, that 10, 15 minutes, it'll drive it right up there, no problem. The sunscreens themselves, again, so we do want to decrease the risk of skin cancer, and skin cancer is rising, and I would say that that protection is there. The problem is that some of those sunscreens, they have parabens in them, and people react. They can get skin rashes and other things. And so what you want to look for are good quality sunscreens from health food stores that don't carry those kind of nasty chemicals that are there. And you'll find them. They're out there as well too. In fact, those websites, they'll list sunscreens, which are good quality sunscreens and which are ones that you might want to stay away from.
If a person has been diagnosed with cancer of some kind, and they would like to come and see you, do they have to be referred by their family doctor?
No, for InspireHealth, no referral is necessary. So people are welcome to come with or without referral, yes.
You have never, excuse me, you have never mentioned drinking a lot of water. Is that not so important anymore, or?
It's very important. It's just out of the, is my mic on? Out of the number of things that we were talking about, here I'll use yours, the number of things that we were talking about, it wasn't one that came up, but staying hydrated is very important, but everybody needs a different amount of water. You'll notice that I always have a big jug of water beside me, but Dr. Schnurr doesn't always, or his water's much smaller. I'm impressed you drank a lot more water. What you want to make sure is that your urine is clear. If your urine is clear or pale yellow, you're hydrated. I burn through water a lot faster than most people, and that's what it takes for me to be hydrated. So watch and then make sure you're getting enough liquids in. Make sure they're away from meals, so that way it doesn't affect your digestion, but absolutely water is important.
Like 2 liters a day?
It all depends on the person. For me, it's 4, but I can't imagine you would need 2 liters. You can never drink 2 liters. So it all depends. It really depends on the person. Your urine will always tell you. Unless you've had B vitamins, then it'll be fluorescent yellow, and that's just how it is. Wait a few hours, and when it goes from fluorescent yellow to a normal yellow, that's when you'll notice whether or not you're hydrated.
But I do drink almost 2 liters when I've been exercising.
Yeah.
During the summer as well too, if I've been out for a long hike, I'll probably drink even more than 2 liters. And so it does depend on activity level as well too, and ambient temperature and how much you're sweating.
And the water in your food.
And I was just going to say, it also depends on what you eat. I mean, if you're eating foods that have lots of fluid in them as well too, then yes, you're getting that fluid in. It doesn't have to be so that 8 glasses of water. I don't really think there's any real strong evidence that says it has to be 8, because it really, as Lisa says, it depends on each individual and then on activity levels and what you're eating as well too. Yes.
Is there any foods, or what foods would be high in vitamin D?
So the question was, what foods would be high in vitamin D? Fish, so that oily fish can be. It is a fat-soluble vitamin, so you'll find it in more kind of the sort of fats and that type of thing. Dairy products will as well, although I'm not a big fan of dairy products for the most part. But beyond that, you don't tend to see vitamin D in many other foods, and so there really is no way. I don't think there's any way that people can eat enough foods to get their vitamin D level up as well too. Yes.
How do you know whether you need extra vitamin D or not? You said some people should be taking it.
So the question was, first off, was how do you know whether you need extra vitamin D or not? And again, vitamin D is one of these things where if your level is low, you're probably not going to have any symptoms. So there's no physical way that you can tell that you're low in vitamin D. Although sometimes, again, chronically low vitamin D can be associated with more development of things like, and it has been shown to be associated with increased risk of developing things like diabetes and arthritis and heart disease and neurological diseases like MS and those kinds of things, and cancers, of course. So it's kind of more preventive at this point, and it's always easier to prevent than it is to treat. So the only way we know, we can't tell if our levels are low unless we get tested for it. Certain people, if they have things like hypercalcemia, so if they've got too much calcium already in their blood, they would have to be careful about taking any vitamin D supplements. The individuals with what are called granulomatous types of diseases, tuberculosis, that kind of stuff, should generally avoid vitamin D as well too. And so there are a few situations in which we would avoid vitamin D. Any other questions? What? That was, I think, from an. I guess I'm talking too loud. The Norwegian study, I believe, was published in the journal Psychosomatic Medicine Journal, I believe. I think if you just Google, Norwegian laughter study, I think you're going to find it. And usually the only problem is that when you Google things like that, they'll only give you the abstract and not the whole of it. But I think at least you'll get reference to maybe which article it. Okay, but there's. I've been cut off again.
I think mine's still working.
Well, I just wanted to take this opportunity to thank you all for coming out tonight and such great questions. I'd like to again thank our hosts for inviting us here as well too.
Thank you very much.
Dr. Schnurr is the first speaker that's actually gone through 3 mics. We're down to 1 attached to Lisa. So he had a lot to say, great valuable information. I just wanted to show you that we do have natural sunscreen that's safe here, made in Canada, a couple of different brands as well as some American companies. So these are really handy. We're into spring now, the sun's coming, so they're here. Vitamin D, of course, always in the store. Lots of organic produce. 100% certified organic produce, if you didn't know that already. So that's very, very safe, non-irradiated. Oh, I have another mic coming.
That's
okay, so if you would like to ask either Lisa or Dr. Schnurr some questions one-on-one, you're welcome to come forward now. And please do so. Take advantage of the fact they're here with us tonight. We'll get our staff cleaning up the chairs out of the way so you can look around and shop. Of course, the tills are going to open now, and feel free to get any help you need finding any products from our staff. Thank you.